Depression affects more than 16 million adults in the U.S., but could a breakthrough treatment offer relief without medication? A new procedure uses a laser to penetrate the skin and skull and reach areas of the brain. It's a treatment some believe may help alleviate symptoms of depression. Dr. Theodore Henderson, the founder of Neuroluminance Brain Health Centers, is here with an in-depth look at this treatment. So first things first, Doc, I just want to ask you, how does this treatment work?
Well, the first thing to understand is that depression is a degenerative process in the brain. It actually kills neurons, destroys circuits. Parts of the brain actually get smaller, they shrink in depression. So anything that happens to rebuild that is going to be helpful. Now, the infrared light that we use actually penetrates through the scalp and the skull of the bone into the brain, and it activates not only the production of energy, but it also turns on a whole bunch of second messenger systems that turn on things like anti-inflammation properties and growth factors, such as brain-derived neurotrophic factor, or BDNF to its friends. Now, BDNF is the brain repair factor. It actually rebuilds circuits, makes new synapses, dendrites grow and get fancy and make new circuits. So this is a process that goes on over weeks after the treatments start.
How does this compare? I know we've done segments on the show about using magnet therapy, the transcutaneous magnets. How would this modality compare with that?
All right. So transcranial magnetic stimulation is based on the idea that a magnetic field creates electrical currents within the brain. And we've used electrical currents, electrical shock therapy, for years, decades, as a treatment for depression. It remains one of the best treatments. It just has a lot of side effects. TMS is helpful, but the response rate to TMS is about 50%. And a recent study said it's not even as good as that compared to placebo.
The more modalities we have to potentially treat depression, the better. Dr. Mike Dow is a psychotherapist. You're still here with us. I'm curious because you deal with a lot of patients who are depressed, and the first step for many people is they're put on antidepressants. I'm curious your thoughts on technology like this.
I love it. You know, so in reading his research and reading some of the data and the clinical studies, it is yet another tool in our toolkit, and that's really exciting. It's exciting for people who, number one, are looking for a drug-free, natural option without drugs, and it's exciting for people who have failed either cognitive behavioral therapy that you may do with me, or for people who have tried different antidepressants, drugs, and they don't work. So the studies and the research show that this treatment actually helps those people that aren't served by other options. So if you have major depression, if you're what we call a non-responder, this may help you.
Is there any downside to this, Dr. Henderson? Because it basically sounds like, and watching that, it looks so benign, it sounds so good, but sometimes I worry when something sounds so good, what am I missing?
You have to understand the Neurolaser Foundation that Dr. Larry Maurice and I founded is devoted to treating traumatic brain injury and other disorders with the laser therapy. That study was a study of patients with traumatic brain injury who also had depression. And so we looked at how their depression scales changed. And what's remarkable is within 8 weeks, some of these people were better, symptom-free of depression.
And how long were those results sustained?
We've followed these patients now, both our traumatic brain injury patients and veteran and depression patients now for 7 years, and they remain symptom-free. So one of our patients, we treated her 4 years ago. She had severe depression. She was in the black hole, she could describe it. She was suicidal every day. She couldn't get out of bed. Her situation was complicated because she had a hypoxic brain injury from a severe pneumonia. We treated her. She got better. She's now on a little tiny bit of Wellbutrin, a great antidepressant, and she went through the death of her mother in January. And that would put anybody back into the black hole. And she said to me just the other day, "Doc, I went through these 6 months and I didn't fall back in that black hole. I didn't feel suicidal. I felt sad, but I did better."
Well, we thank you so much, Dr. Henderson, for being here today. Dr. Dow, thank you for your input. And I would just say that if you are concerned you or a loved one might be suffering from depression, this is not something you want to hide from others. There is no shame, there is no embarrassment. reach out because there are now so many different treatments. We're going to have more information on this particular treatment on our website.